Dr. Venincasa has been providing quality dental care in a professional manner since 1986. Although his expertise is in cosmetic, restorative, and single-visit restorative dentistry, he also provides general and family dentistry. Dr. Venincasa earned his doctorate in dental surgery from the University of Texas Health Science Center in San Antonio, Texas. Dr. Mark Venincasa is here with us to discuss bruxism. Welcome, Doctor. My first question to you is, what is bruxism?
Bruxism refers to the wear that occurs on the teeth that generally comes from grinding. So I would say that 40 or 50% of the population has that. I've seen research that shows very similar numbers. So it's all across the country. There's 40 or 50% of patients that show advanced signs of wear. And so this advanced sign of wear is caused from this bruxism, or from this clenching or grinding that wears away at the teeth surfaces. So we can know that patients are doing that just by looking at their teeth. It's very similar to looking at tires on a car. If a patient has had tires on a car for a while, you can see some sign of wear. Sometimes if there's a misalignment or some problem with the car, the wear might be more irregular and more advanced. And so when they go to the car place to have their tires looked at, they can see that. And even if the tires are only 3 months old, if they see the wear, there's no doubting that the wear is there because you can see it. It's the same way with the teeth. Teeth are out of alignment if their bite isn't quite right. If they're under a lot of stress, they're going to clench and grind their teeth in 40 or 50% of patients. And so we can see that wear. And the way we can see it is, we know what teeth look like. They're very much, you can almost look at one tooth and know exactly where it belongs in someone's mouth because the teeth are that specific as far as how they're shaped. Teeth are also very rounded. There's grooves and such like that, but teeth don't naturally have wide, flat surfaces. And in patients who clench or grind, they're going to show these flat surfaces on their teeth, and we can easily see that. And one way that we help enable patients to see the damage that we see is by taking pictures of their mouth. We can have one tooth on the monitor blown up, of course, widely magnified, and we angle the lens so that the light reflects that flat place on the tooth, so the patients can really appreciate the flatness of that surface. And once they understand that naturally, they really understand and realize, oh my, I really have worn my teeth over time. But a lot of times they will absolutely deny that they grind. But like I said, we see what's on their teeth, and it's like that old saying, the proof's in the pudding. And we don't strong arm the patient into believing it. We just show them the pictures, and that's the proof right there. They'll say that they sleep with their mouth open, or that they have allergies, they can't breathe through their nose, so their mouth is open a lot, or they say that their spouse doesn't recognize any noise going on from clenching or grinding, but we explain to them and show them in the pictures what's going on. And sometimes it just takes a while for patients to understand that that's what they're doing. And a lot of times after we talk about it, they might come in for their next cleaning like 3 months or 6 months later, and they might admit, after we talked about this, I find that I do clench or grind when I'm driving, like at rush hour, or when I'm working on my computer, I clench and grind my teeth, or when they're doing something, maybe there's a habit, a hobby that they're working on, and they find that they just kind of clench or grind, and that's when they start to understand, okay, now I believe you, now I can understand that there is more going on than I thought. Let's go ahead and get the night guard, or let's go ahead and look at what we need to do to change the way my bite works so that I can limit the damage that I'm doing to the teeth. And then in those cases also, in every case where there's this bruxism, we recommend this special guard so that we can protect the teeth from wearing down any further, at least while they're sleeping.
What causes bruxism?
The most common source of bruxism, or the common reason why there's bruxism, I would say it's stress. I mean, that we all live lives that are just stressful. We try to fit it a lot into our lives. We have other people that we consider family members. We've got our jobs. A lot of times there's two working people in the household, and there's just too much going on in our lives, too much that we want to fit in, and this causes stress. And so again, 40 or 50% of patients, they have this contribute to the bruxism that they have. In other cases, it has to do with the alignment of their bite. Maybe they had orthodontics, maybe they never had orthodontics, but there's something about their bite where subconsciously their body overnight is trying to reshape the teeth in a way to create an ideal bite. This is the way I can try to explain it. But the problem with that is, with the clenching or grinding, the ideal bite never happens. It just gets worse. And so the grinding continues. So in those cases with the bite, that needs to be addressed, or it needs to be considered, and then a night guard also is recommended, just to help prevent any more damage to the teeth.
What are the main symptoms and signs of bruxism?
As far as symptoms, there might be no symptoms. We'll have patients that deny that they have bruxism, although we can show them proof that there is bruxism by showing them the areas of wear on their teeth. But they might have no symptoms, kind of like high blood pressure. A patient has no feeling that they have high blood pressure, but when they get it measured, that's the proof right there. In other cases, patients very well can have symptoms of bruxism. It could be headaches on the side of their head. They might have pain on the back of their head, or even pain in their shoulders or area. In other patients, they have just severe sensitivity to cold. And that's because they apply so much force on the teeth that they become inflamed. And just like any other part of the body, when it gets inflamed, it becomes more sensitive to things it normally should not be sensitive to. So they might not be able to eat ice cream. I'm not saying that every patient that's too sensitive to eat ice cream has bruxism, but that's certainly something that can be a sign or a symptom of bruxism. Another thing is tightness or tiredness on the side of their face, particularly in the morning, because they've been grinding, for a lot of the night. So they might have toothaches. There's a lot of toothaches that we find that aren't really teeth that are in need of a root canal. There's nothing wrong with the health of the tooth, but the reason why they're having symptoms of a toothache is because there's something about their bruxism, about the forces that they're putting on their teeth, that's leading to putting too much pressure on the tooth, and so it gets inflamed and causes those symptoms of a tooth that would be like perhaps needing a root canal. So I'd say it's very important to really have everything checked to see if clenching or grinding is having an effect on the teeth, so that work is not done unnecessarily.
Should one try a mouth guard?
We've had some patients who have tried to buy like a mouth guard at the store. I can think of maybe 2 patients that are fairly successful with that. The reason why those store-bought guards don't work as well, they're usually bulkier. The patients are fitting it at home, so the fit is not near as precise as what we can accomplish through our guards that are made in a dental lab. They're very precision made. Ours are made of a hard plastic. In the store, you can only get like a rubbery kind of material. And it's protective, but when you think about it, with those soft guards that you get at the store, you're biting primarily on the back teeth. And I always compare it to like having in your hand a tennis ball or a hockey puck. If you've got a tennis ball in your hand, you're kind of wanting to play with it, to squeeze on it, and that's what happens with those soft guards. So while patients are sleeping at night, they're squeezing and unsqueezing on that soft guard, which seems real comfortable, and maybe it's subconsciously pleasurable, but the problem with that is that the muscles are working really hard while they're sleeping, And so that's not going to help to relieve the tension or the headaches that can develop from the neck, the back, the temporal region, or over here in the masseter muscles. So the soft guards can protect the teeth, but they're not going to help with everything else. But also, like I said, for all of the patients that we know of who've tried the soft guards from the store, I only have 2 who've really had any kind of success. And so our guards really are so much more successful, and they're harder. And when we make them, we precision make them like a TMJ appliance so that we actually put a specific bite into them. It's kind of like having an insert. Not many patients, but some patients need a special insert for their shoes inside to help them with back problems, or maybe the length of their legs are different. So I don't know much about that, but there's different reasons why a specific kind of insert has to be put in the shoes. We do that for inside the mouth with the guard. We make it a very certain way. So we take the pressure off the back teeth. We make it to where it's impossible for the muscles to work really hard. So there's really not a very close comparison to the guard that we make and the guard that patients get in the store. But like I said, with our guards, the patients are a lot more comfortable with it. And to be honest with you, 20 or 30% of our patients absolutely love our guard and absolutely can imagine being without their guard. They do it every night because they realize that it's made them less sensitive to ice cream. They realize it's comfortable because they don't have tight or hurting muscles. Maybe their headaches went away. They just recognize something about the guard that's really helping them. And for others, they just feel like they're doing the best they can. They maybe exercise twice a day. They're very diligent with everything they do. And so they just have to wear the night guard, and they just can't imagine being without it. So I really do try to get patients to consider getting our guard, because I know it has too many more things about it that help the patients. But we let the patients make those decisions. And a lot of times they try the store-bought one. They know it's an apples to oranges comparison, but they want to try that anyway because they want to save money. And ultimately, a lot of times they'll come back and say, okay, let's give yours a try.
When should a person decide to seek medical advice?
I would say, of course we're a dentist, and so most times we ask patients to see a dentist every 3 to 6 months just to help in the way of prevention, whether they have bruxism or not. And as I indicated before, bruxism could be totally without symptoms. Patients might have no idea that they do clench or grind. So if there's a toothache develops, most patients are going to contact a dentist anyway. But that can show through the exam that clenching or grinding on the teeth is what's causing the tooth problem. Just because you have symptoms of a toothache does not at all mean that you need a root canal. So I would really advise patients to make sure that everything's considered. If they clench or grind, that needs to be on the table, because a lot of times that is exactly what's causing the problem with their teeth. So when it comes to when should a patient get medical advice, if you feel like you're clenching or grinding, if you're getting these pains on the side of your face or tension or headaches on the side of your head or in the neck and shoulders, definitely do that. But like I said, a lot of times you have no symptoms. So I would just recommend you're continuing with your preventive visits, which hopefully the patients are doing every 3 to 6 months.
What further can be done to stop grinding the teeth?
To stop grinding teeth, the night guard isn't going to stop the grinding. A lot of times stress causes the grinding. It's hard for patients to get rid of stress. I understand that. Seems like stress can always exist. It's how we manage the stress that can help minimize the grinding. But I can't say that minimizing stress in your life is going to stop the grinding. There could be other factors, or there could be stress that we don't recognize. So there's something called biofeedback that can help. But when we're sleeping, I actually don't know how effective biofeedback is. because when we're sleeping, we're generally not aware of what we're doing. So maybe with biofeedback, there could be like an alarm or something that patients are always hooked up to it while they're sleeping, so that when that alarm goes off, they can recognize maybe what they're doing. But again, I'm really unsure of how effective biofeedback is. If it's something that you absolutely want to try to stop, I would try to look for someone in your area who's a biofeedback specialist and ask them about it. It's a little bit beyond my scope and beyond what I know, but that's the only thing I know of that can potentially stop grinding.
What are the risk factors of bruxism?
Oh, I could go on and on about this one. Bruxism, of course, causes forces on the teeth. So with these forces, they can actually weaken the teeth. Teeth can get cracks, and once those cracks form, further bruxism can cause the teeth to kind of flex and open up those cracks. And this microscopic flexing, I know that teeth are hard, but they can still flex when forces are put on them. And so decay can form inside those cracks, or the cracks can get deeper, and that causes the tooth, maybe a corner of a tooth, to break away, or it can cause the crack to propagate to the nerve of the tooth and cause a massive toothache. So what bruxism can also do, from the flexing of the tooth and the cracking, not only can decay get in between the tooth segments along the crack, but that flexing kind of opens the junction or the margins that exist between the filling that might be inside the tooth as well. And so that allows decay to get in between the seam or that junction or margin that exists between the filling and the tooth. And we see this a lot. Where decay just forms, the filling looks like it's doing totally fine, but there's all this decay underneath the enamel surface of the tooth. There's not a hole, so to speak, but when you look at the tooth, it looks like these dark gray clouds that you would see in the sky. That's an indication that there's decay inside the tooth, caused only by the huge forces that exist on the teeth from bruxism. And so in my mind, easily, bruxism causes most of the dental problems that I see in my dental practice. In really rare instances, like once or twice a year, we'll actually have a patient just break off a tooth at the gum line, or the tooth will crack vertically all the way down the end of the root, causing the tooth to not be salvageable. So we have seen so much happen for bruxism, and so that's why whenever we see evidence of wear, we always invite the patient to pursue at least a knife, just to take the load off the teeth and to remove some of these very harmful effects that can occur. In my mind, again, bruxism, or the forces on the teeth, is the greatest contributor to problems in my dental practice, because we have fluoride in the water. In other areas, San Antonio, at a time when they did not have fluoride in the water, and for sure not having fluoride caused most all the problems there at that time. But when there's fluoride in the water, for sure, bruxism causes most of the problems. Really, patients, if you've got that clenching or grinding, it really would behoove you to really consider getting a guard.